Namaste and good afternoon. Greetings from all of us at Apollo Hospitals. This is Dr. Srinidhi Chidambaram, and I'm very happy to see you all again. I hope you've been well and in the best of health and spirits. The first step to conquering any disease or health condition would be to understand it thoroughly. However, this is not always easy because medicine is a complex subject and there is enough of misinformation out there on social media that can confuse and mislead you. That is why we have been presenting these Facebook Live sessions regularly to help you know all about diseases and conditions straight from our top specialists. Today is World Asthma Day, and I'm sure you're all familiar with the term asthma or bronchial asthma. It is a chronic respiratory condition where there are acute exacerbations. The airways get narrow in this condition and swollen, and they get blocked by mucus. Although asthma cannot be cured, it's very possible to reduce and prevent asthma attacks and live a good quality of life. World Asthma Day is held each May to raise awareness about this condition worldwide. And this year, the theme is Closing Gaps in Asthma Care. And it is indeed very important to reflect on what these gaps can be. They can be gaps in equal access to diagnosis and treatment. They can be gaps in the care which is given to different socioeconomic, ethnic, and age groups, or between wealthier and poorer communities and countries. It can be gaps in awareness, communication, and education, quality of care, and even in the knowledge of asthma among healthcare providers. So we all need to work together, that is communities, patients, and healthcare providers, to identify and close these gaps. So today, I hope our session will help in closing all the gaps in your awareness about asthma and to guide us and explain about this common health condition and also help you realize how you can live your best life with asthma. I am very happy to welcome Dr. L. Sundararajan. Dr. Sundararajan is a respiratory medicine specialist working at Apollo Hospitals, Chennai at Greens Road. He has over 30 years of experience in this field and 18 years as a respiratory physician. He has trained extensively in pulmonology in the United Kingdom and has also worked there for over 2 years. And he's been with Apollo Hospital since 2010. Dr. Sundararajan completed his MBBS from the Madurai Kamaraj University in Tamil Nadu and his MD in General Medicine from the Tamil Nadu Dr. MGR Medical University, and is a member of the Indian Medical Association, Tamil Nadu Medical Council, Fellow of the Royal College of Physicians and Surgeons of Glasgow, and member of the Indian Chest Society, and has published several research papers in international journals and meetings, and has also had the Certificate of Completion of Specialist Training from the UK and from the Postgraduate Medical Training Board UK. Welcome, Dr. Sundararajan, to this session
Thank you.
on bronchial asthma, and we look forward to hearing all about managing this condition from you today.
Thank you for the introduction. Thank you.
So I think we will just begin right at the very beginning with the basics. So what exactly is bronchial asthma?
Yeah, as you mentioned before, bronchial asthma is a chronic condition which is characterized by narrowing of the airways, basically. The airway has got smooth muscle. It has got a lot of mucus glands. So in asthma, there's inflammation in the airways, which causes not only increased secretion of the mucus and swelling of these glands, which line the respiratory mucosa or the lining of the airway, but it also there is also an element of constriction of smooth muscles of the airways. So it's almost got a double whammy effect. So the smooth muscles constriction and the mucus glands hypertrophy or swelling, causing narrowing of the lumen. So this leads to bronchospasm or narrowing of the lumen of the airways. This typically causes the asthma symptoms, which leads to the commonly expressed term like wheezing or the noisy breathing or whistling noise when they breathe. So asthmatics experience these symptoms like chest tightness, wheeze, and they may have cough also because of the narrowing of the muscles and the narrowing of the airway. they may feel breathless. So as you explained before, there is the asthma is characterized by exacerbations. So it is not the airway narrowing is not is a kind of a dynamic condition, which can have flare-ups, ups and downs. So several factors can trigger these. So asthma patients typically have several attacks triggered by various trigger factors. They may have exacerbations when the symptoms increase and lead to poor quality of life. So that's what asthma is about. Yeah.
Oh, right. So what causes asthma? Like, what are the factors that make somebody an asthmatic as opposed to, is it like an inherited condition or something like that?
Yeah, you're right. So as there are probably what we can say is there are typically two types of asthma. One is an extrinsic asthma and another is intrinsic asthma. This kind of classification is an old classification, but still holds true because sometimes it may be purely allergy driven. So external allergens can drive asthma, where common allergens are like house dust mite, various other like pollen allergens, various inhaled allergens. Whatever you inhale can cause the effects of asthma, which I described before, the narrowing of the smooth muscles and swelling of the mucous glands. So this can be triggered by various of these external factors, like what I described before. There's also another entity where it is more intrinsic. You can't clearly identify an external allergic factor, but for some reason, the airways are intrinsically very sensitive and they go into these spasms now and again. So this is kind of an intrinsic asthma. The typical extrinsic asthma or the allergic asthma you see in the younger people, which develops before the 20 years of age. The intrinsic asthma can come to light in maybe later stages of life as well. So the other question you asked was about hereditary effect. Asthma does run in families. If you have a strong family history, there is some genetic predisposition as well to developing asthma. So if you have a strong family history, then there is a increased likelihood that one may also develop asthma.
So what is the earliest age in which asthma can manifest? Like, can it happen in newborns and infants, or is it like later on in childhood?
Yeah, there is a clear entity of a type of asthma. Childhood asthma is also there. It can come as early as 2 years of age. 2 years of age, even that at the age, children may have a lot of allergies. This is the typical allergic asthma or the extrinsic asthma, where you have a lot of allergies. They may have skin allergy. They may have allergy in the nose. They may have allergy. They may have hay fever, and with that, they may also have asthma. So that's earliest is even less than 2 years they may develop asthma. Most often, these young patients or children are treated like respiratory infections, or before it is realized that it is actually asthma. They may have typical symptoms of asthma in the form of wheezing and repeated respiratory infections. They may receive multiple courses of antibiotics, but then it will come to light that it is actually asthma that we're dealing with. So sometimes these young children may kind of grow out of asthma also, but many of them may continue to have asthma in their adulthood also. But there's also another entity of late onset asthma where it can typically start after 50 years of age, 40 years, fourth decade or fifth decade, it can start as well. There, it's not more than allergy, it's more intrinsic. It is more internally, there are problems in the airways, which can also lead to late onset asthma. So it is a kind of a both spectrum. The spectrum can be at both sides, very young age and also starting late in the fourth or fifth decade as well.
As you said, there are triggers like household dust. So could you tell us a little bit about, what are the common asthma triggers?
Yeah, typical asthma triggers, I would say, include many dust, including house dust. When I say pollution or dust, people always think of outdoor pollution, but indoor dust also plays a major role. Indoor pollution, basically, it could be smoke from the kitchen, or fumes in the house, or it could be anything from agabatti, or intense smells, like strong smells like perfumes, dyes, and dust. The house dust mite is one of the major triggers for asthma, and house dust mite is rampantly present in the bed linen and mattresses and pillows and bed sheets. So that's why many asthmatics tend to have symptoms in the night or in the early morning, because they're all night they are exposed to the house dust mite, which they are inhaling from their mattresses and pillows. So that's one side. The other things could be, of course, outdoor pollution also plays a role. So that's one of the triggers. The other triggers can be viral infections. Viral infections increase the tendency of asthma or make asthma worse, or leads to more asthma flare-ups. So that is why typically we see asthma exacerbations happening more in the rainy season or the winter season, when viral infections are more prevalent. Of course, family history also plays a major role as a trigger. Sometimes acidity, acid reflux can also exacerbate asthma. And of course, definitely not to forget smoking. Cigarette smoking definitely is a big no-no for asthmatics. In fact, it damages the airways in multiple ways, and it only adds to, if an asthmatic also has a history of smoking, it only makes matters worse.
Now, there are two things which I wanted to pick up from what you just said now about this household dust mites. So you said that it's rampant in bed linen and in many places. So could you also tell us, I'm sure people would like to know how to identify this, or how to kind of clean it up?
Yeah. See, history is very important. Any asthmatic, we typically ask history, and many times it comes out that their symptoms are particularly worse in the night or early morning when they wake up. And they wake up with sneezing, wake up with chest tightness, cough, breathlessness, wheeze in the morning. That typically tells you that it is triggered by the house dust. The one of the ways that you could do blood tests, you could do blood tests, you could do skin prick tests to kind of diagnose whether this is really a element of allergy. There are tests available now to look for specific allergens also. Specific skin tests can be done, skin prick tests can be done with various of these antigens. These house dust mite is, of course, an antigen. We can test the antibody levels to these antigen, and thereby we can prove that it is due to house dust mite. Of course, there are several other allergens as well, including cockroach, pollen, as I said, pollen before, and various even food substances, some things like apples and pears and things like that, and also sometimes cat and dog hair or secretions. Those kind of things also can be tested by skin prick tests or blood tests. To some extent, it can prove that, so that we know that this is what we need to avoid.
And talking about foodstuffs, you were mentioning apples just now. So one has always heard that people like to avoid sour foods, or they would, for example, avoid pickles or tomatoes. So is that again like highly variable and needs to be identified through testing?
It is very variable, because several things can cause allergies, and leading to asthma. It may not necessarily need to asthma, it may need to allergy. Intolerance may be there. So we have to distinguish between intolerance and real allergy, because intolerance is basically they may get different side effects from eating something. That's not true allergy. Allergy, happens, we call it allergy when they have serious side effects from ingesting something. Like, for example, if somebody eats peanut and they develop really lip swelling and tongue swelling and breathing difficulty, chest tightness, that is typical anaphylaxis or a typical allergy. So that needs to be definitely avoided. But whereas if they develop intolerance in the sense that they develop some vomiting or diarrhea, something like that, that may not be true allergy. Actually, it may be more intolerance rather than allergy. We have to make this distinction. Having said that, there are several substances, food substances can cause problems in asthmatics, but the list is very long. So what I tend to do is I don't tend to routinely say in my practice, I don't routinely tend to say that, advise them to avoid everything. I don't give them a big list, because they can themselves keep a food diary. A sensible way or common sense approach to this problem is by keeping a food diary, noting down what you eat on a particular day and what happens to your asthma symptoms. If your asthma symptoms are worse after eating anything in particular, then it makes sense that you avoid that. It could be seafood, it could be prawns, it could be meat, it could be an apple or pear. There are all these soft skin fruits. They can cause allergies, oral allergies, and can lead to asthma symptoms. So it is, in a way, that is, rather than testing, there is no specific test that we can, unlike inhaled allergens where you can do skin prick tests, the ingested allergens is very difficult to prove them by doing tests, either blood tests or skin prick tests.
So only by elimination we can kind of figure
Correct.
out. Correct. Yeah. Talking about viral infections, how can we forget about COVID-19, which is still lingering amongst us? So is there any correlation between people who have asthma, and is it any worse because of COVID, or are they more vulnerable to COVID, vice versa kind of thing?
Yeah. Any viral infection, actually, viral infections, usually most of the respiratory viral infections, the common influenza virus, the common cold virus, all these viruses, they, trigger hyperreactivity in the airways, by which I mean that the airways become more sensitive. The muscles become more excited, so they go into spasm. The glands, the mucus glands, become more hypertrophied. They secrete more mucus, both of which lead to more airway spasm and narrowing of the airways. So it's a typical, effect, post recovery effect from a viral infection. Of course, this is the same thing we have been observing in COVID as well. So at the end of the day, COVID is also caused by a coronavirus, which is a respiratory virus. Okay. So that is why we see more of these asthma symptoms in people who have had a recent viral infections. But not all of these need to be asthma. Some of them, many of the post-COVID patients we see, they come with cough and a bit of breathlessness and a bit of chest tightness and wheeze. But when we do all the tests, not necessarily everyone has asthma. They may just have what we call reactive airways, or a post-infective kind of hyperreactive airways. So it may settle down in few weeks or months' time. It may settle down. So we have to keep a close watch on them with a test to make sure that they don't develop overt asthma or full-blown asthma. Many of them, with some simple treatment, they may respond to these treatments and recover fully. But some of them may go on to develop asthma as well in the future. So that's why I said we need to keep an eye on these people who develop symptoms in the post-COVID setting or in a post-viral infection setting.
So coming back to asthma itself, what are the complications, and what are the situations in which it can become an emergency or might become life-threatening?
Correct. Yeah, asthma can be a life-threatening disease as well. It's although it is, because it causes severe narrowing of the airways. So there are various degrees of asthma, ranging from mild asthma to moderate asthma to severe asthma. And severe asthma can be life-threatening because of extensive, severe narrowing of the airways. They may go into frank respiratory failure. They may go into coma as well, and may need emergency admission, sometimes so much so that they may need intubation and ventilation and intensive care unit level care. Thankfully, this is becoming much less of a problem now because of the increased awareness. People are more aware of the problems with asthma, and also that there is more treatment available nowadays than, say, 2-3 decades ago. So now better treatment is available, more specific treatment is available, and more meaningful treatment is available, more effective treatment is available, thereby avoiding patients from going into this severe stage. But still, we do see about 5% of asthma tends to be severe asthma. So there is this 5% is not a small number. So 5% of asthmatics are usually severe asthma. So the typical complication that they develop is they go into respiratory failure, by which I mean that They may require ventilatory support. They may require oxygen and ventilatory support and intensive care unit level care. So that kind of complication.
Now, supposing somebody has been diagnosed with asthma, and is there something that they are not doing or something that they need to do so that it doesn't reach up to, the most severe type of asthma? Or is it like, for example, do they take treatment early, or, if they use the inhaler, to keep it with them? So are there any tips for people? And is there a situation where you can actually avoid it from becoming a severe life-threatening condition?
Yeah, asthmatics, as we mentioned before, it's a chronic disease, particularly the intrinsic asthma is a chronic disease. So people have to understand that they have to have regular checkups and regular reviews with their physician, and take their medications properly. One of the common problems is that because this is the disease with a lot of exacerbations and flare-ups and periods in which it tends to remain quiet. So people tend to patients can become a bit complacent and forget to take their treatment or omit their treatment, which can lead to problems. So regular checkups is important. And in regular checkups, I also think one should not forget the role of pulmonary function testing, which will tell you where your asthma is. Pulmonary function testing is a definite way of confirming your asthma, not only confirming your asthma, but also finding out the severity of your asthma. So very, very important tool, which we use routinely in our practice. So patients need to be doing this so that they know where they are in terms of their asthma control. And they need to take their medications also regularly. If they take their medications regularly, they can keep their asthma under very good control. Although it's not a curable disease, it is definitely controllable to a great degree. One of the other problems is also some patients, a small percentage of patients, also have poor perception of their symptoms. These are typically called poor perceivers. So they tend to underplay their symptoms, and they don't seek attention till things become very critical. So that is one problem. So we have to identify, it's our role to identify patients. From the patient's point of view, we have told about the trigger factors. They have to avoid the trigger factors. Smokers definitely need to quit smoking and avoiding allergens. And viral infections, of course, one cannot avoid viral infections. So there are vaccinations available. There is some data to suggest that annual influenza vaccination does help these patients to reduce the frequency of viral infections, thereby reduce the severity of asthma exacerbations, and take their medications regularly.
So coming to medications, what are the different types of treatments that are available for bronchial asthma?
Yeah, so we talked about two important mechanisms in the asthma onset of the asthma pathogenesis. One is the muscle constriction, and the other is the swelling of the mucous glands or inflammation. We call this inflammation. So asthma is an inflammatory condition, like what you call arthritis. Arthritis is an inflammation of the airway. Arthritis is an inflammation of the joint. Asthma is an inflammation of the airway. So by which I mean that there is swelling of the glands in the airway and also constriction of the smooth muscles. So there are two things happening here. So there are two types of inhalers for asthma, and inhalers are the mainstay of treatment in asthma. So one of the types of inhalers is a reliever, which relieves symptoms quite quickly, and the other is a preventer. So the reliever inhaler, they tend to work on the smooth muscle constriction, the muscle constriction. They relax the muscles and thereby, dilate the muscles and dilate the airways, thereby, giving them the breath that they need. The other preventer inhalers, they reduce the inflammation in the airways. So they work on a long term. So they work long term. It's not short acting. They work long term. So the long acting inhalers, they prevent the patients from developing symptoms. So the preventers are actually the mainstay of treatment. The relievers are only temporary. They work temporarily to relieve the bronchospasm by working on the muscles. So these two inhalers are available. Two types of inhalers are available. Depending on the stage of the asthma, I said mild, moderate, severe, we prescribe inhalers, and the dose of the inhalers also depends on the severity and the type of the asthma. So the preventive inhaler are the mainstay of treatment. That's what they need to be taking on a regular basis. The reliever inhaler they can use as and when required, when the preventer alone is not enough to control symptoms. When they are developing symptoms in between the preventer inhalers, then they can use the reliever to get immediate relief. But the reliever inhaler should not be used as a regular treatment.
We also have recently read about procedures like bronchial thermoplasty and all that for, is that applicable to asthma? And I think recently also we have done a similar procedure in our hospital. So what are these latest innovative treatments?
Yeah, there are, in addition to inhalers, what we've been using, there are newer treatments available now. I told you about extrinsic asthma or allergic asthma. Yeah. It is the allergic asthma is mediated by what we call immunoglobulin E or IgE. So it's an immunoglobulin which causes the asthma symptoms in these individuals. So this by blocking these IgE, by reducing the level of IgE, we can control asthma symptoms, control asthma exacerbations, and control the severity of asthma also. So there are what we call monoclonal antibodies available, which work on these IgE molecules. So that's one type of treatment. The other type of treatment where it is not driven by IgE, where they have got a lot of symptoms and they're requiring very high dose of either inhaled steroids or oral steroid tablets, then those patients may benefit from thermoplasty. Bronchial thermoplasty is a technique where we put in a bronchoscope, which is a camera, into the airway, and through that a heat source is applied to the airways. The principle behind this is that by applying the heat source, we scar, to some extent, we cause scarring in the airways. So the airway muscles are scarred, thereby they cannot go into constriction. So we stop them from constricting by making them scarred. So the scarred muscles cannot constrict to the same level as the normal respiratory muscles. So that's a principle behind this. But you should be very selective in using this therapy. This is not available everywhere. As you said rightly, we have this treatment available in our hospital. So it's available in many of the other centers. So patients should be carefully selected by the pulmonologist, and after proper review and proper review of all the reports and the type of the asthma, severity of the asthma, this treatment can be recommended to people who will qualify for that or who will benefit from that.
So coming to the quality of life, I mean, you did tell us that there are certain things that people should not do, like, for example, smoking, or they should identify the triggers. So what would actually be like, what could a person with asthma be able to do? For example, would they be able to lead a normal life? Can they exercise? Can they swim? Can they, do, what are the things that they can't do? And what would help them to live as near a normal life as everyone else?
Yeah. To answer this question, I would just use a couple of examples. There are mountain climbers who are asthmatics. There are international level swimmers, Olympic level swimmers who are asthmatics. There are football players, European level, club football players who are asthmatics, and they're on regular medications. So this just means that there's nothing you cannot do. There's nothing an asthmatic cannot do as long as they take their medications regularly and adopt the quality of life. Adopt the lifestyle changes that I mentioned before: quitting smoking, avoidance of allergens, and avoiding viral infections, and take their medications regularly, get their checkups regularly, and they can lead a near normal life. Is nowadays the goal of asthma treatment has moved from avoiding admission and treatment of severe asthma to having a good quality of life, a near normal quality of life. That's where we have come to. So basically, there is nothing the asthmatics cannot do. They can swim, they can do exercises, they can do running, they can do, all sorts of exercises they are allowed to do. As long as they take their medications regularly, they are allowed to do everything. There's nothing should be not possible.
That's indeed very encouraging to hear, Doctor. So there are also a lot of myths and misconceptions about asthma among the people, and one such is that there is also this belief that it's somehow a bit psychosomatic or psychological. And then there is, of course, all those old wives' tales about asthma. People should not. Which is why I asked you. They say you shouldn't go out in the rain, or you shouldn't, swim, or you shouldn't sweat, and so many other things which you have clarified. But what about this psychological aspect? How relevant is this kind of a belief?
Yeah, I talked to you about the trigger factors. One of the things I forgot to mention there was about stress. So stress levels, anxiety, stress due to anything, domestic or work related, or any form of stress, and increased stress levels can exacerbate asthma. There is definitely link. That's why people go for meditation, yoga, and those kind of things. And because of that only this tends to work. But of course, it should be an adjunct to the treatment that you're taking. So you should address that as well. So any stress reduction definitely will help asthmatics. So how much each contributes is a difficult thing. That we'll have to only by proper history taking an assessment of an individual. It is kind of it's not a one size fits all. So for one person, stress may be the major factor. Another person, the allergy, the dust may be the major factor. The other person, the family history may be the major factor. Another person, the viral infections may be the major factor. Some of them, not surprisingly, all of them will be there in equal measure. So you will have to address all of that. Unless if you omit one thing and just concentrate on the other, things don't seem to work. So that's why, I think it's not a bad idea to, go for whatever relaxation. I also don't prescribe any specific relaxation techniques. I tell them whatever, helps you relax, or whatever helps you reduce stress levels, you go for it. Some people, it may be music, it may be sports, it may be just socializing with friends. Whatever is helpful, they can try that. It could be meditation, yoga, whatever, they could try that. Definitely, that is why it helps. So although it is somewhat is a myth, there is some truth in it. Yeah.
Okay. So thank you, Dr. Sundararajan, for this very elaborate and very illuminating discussion on literally all aspects of bronchial asthma. So viewers, I hope that you enjoyed and found this session informative. So be aware of asthma, seek timely medical help, and also, as the doctor said, the best way to get the best quality of life if you have asthma is to take charge of it and make sure that you don't miss your checkup, or you don't miss your medication, and make sure that you make all the lifestyle changes to avoid the triggers. You can reach out to us on any of our social media channels, digital channels, and our hospitals for assistance at any time. And if you have further queries on the topic too, please do write in to us on the comment section or on Facebook Messenger. So see you all soon. Take care. Stay safe. Be healthy. Thank you and namaste.
Thank you. Thank you.